Welcome! I'm so glad you're here, because today we're embarking on an important and eye-opening journey together. Today, we're diving into a topic that touches millions of lives around the world: hair loss, also known as alopecia. Whether you've experienced it yourself, know someone who has, or are simply curious, this is a subject that affects people of all ages, backgrounds, and walks of life. We'll break down what alopecia really means, explore the science behind why it happens, and discuss how it can impact people both physically and emotionally. Understanding alopecia is the first step toward managing it, and we're here to guide you through every aspect. From common types like male and female pattern baldness, which many people will experience at some point in their lives, to rarer autoimmune and inflammatory conditions, such as alopecia areata, we'll cover the full spectrum of hair loss disorders. Each type has its own causes, symptoms, and treatment options. We'll also look at how doctors diagnose hair loss, from simple visual exams to advanced tools like trichoscopes and scalp biopsies. Early diagnosis can make a big difference in treatment outcomes, and we'll explore the wide range of treatments available today, from topical solutions and medications to lifestyle changes, counseling, and even cutting-edge therapies like platelet-rich plasma and hair transplants. This isn't just about science. It's about empowering you to take charge of your health, make informed decisions, and find hope no matter where you are on your journey. We'll discuss the emotional impact of hair loss, the importance of self-esteem, and why support from friends, family, and communities can make all the difference. By the end of this chapter, you'll understand the basics of alopecia, the different types, and the latest research and treatments available. You'll feel ready to ask the right questions, seek the right help, and support others who may be facing similar challenges. Let's get started and shed some light on this often misunderstood condition, breaking down myths and replacing them with facts. Knowledge is power. Let's use it to build confidence, foster understanding, and inspire hope for everyone affected by alopecia. Join me as we unlock the mysteries of alopecia together and take the first step toward a more confident, informed, and supportive future. Alopecia simply means hair loss, but it covers a wide range of conditions. The first big distinction is between non-scarring, reversible, and scarring, permanent alopecia. Non-scarring types like pattern baldness and alopecia areata leave the hair follicle alive, so regrowth is possible. Scarring alopecias destroy the follicle, replacing it with scar tissue, making hair loss permanent in those spots. Doctors also look at the pattern. Is it patchy, diffuse, or follows a specific shape? Recognizing these patterns helps narrow down the diagnosis. Understanding whether your hair loss is scarring or non-scarring is the first step to finding the right treatment. The pattern and type guide your doctor's next moves. Getting this right is crucial for your treatment plan. Alopecia areata is a common yet often misunderstood non-scarring hair loss condition that can affect people of all ages, genders, and backgrounds. It can appear suddenly, sometimes overnight, and can be emotionally distressing for those who experience it. The root cause lies in the immune system, which mistakenly targets the hair follicles as if they were foreign invaders. This autoimmune attack disrupts the normal hair growth cycle, leading to hair falling out in patches, or in some cases, more widespread loss. Alopecia areata most commonly presents as smooth, round, bald patches on the scalp, but it can also affect the beard, eyebrows, eyelashes, and even other parts of the body. The skin in these areas usually looks healthy and normal, without any scarring or redness. For some, the condition is limited to just a patch or two that may regrow on its own. However, in more severe cases, alopecia areata can progress to alopecia totalis, where all scalp hair is lost, or even alopecia universalis, which involves the loss of all body hair, including eyebrows and eyelashes. There's also a unique pattern called ophiasis, where hair loss forms a band-like shape around the sides and back of the head. This pattern can be more resistant to treatment and may be especially challenging for patients. The course of alopecia areata is unpredictable. Hair may regrow spontaneously, only to fall out again later, or it may remain unchanged for years. Some people experience cycles of regrowth and loss, while others see permanent changes. Treatments are designed to calm the overactive immune response and encourage hair regrowth. The choice of therapy depends on the extent and location of hair loss, as well as patient preferences and medical history. Options include corticosteroid creams or injections to reduce inflammation, topical immunotherapy to stimulate the immune system in a controlled way, and other medications that can help restart hair growth. In recent years, new oral medications like JK inhibitors have shown promise for people with more extensive or stubborn cases, offering hope for those who previously had few options. Every case of alopecia areata is unique, and finding the right treatment approach can take time and patience. It often involves a process of trial and error, guided by a dermatologist who understands the condition. The key is persistence and maintaining open communication with your healthcare provider. Tracking your progress and being proactive about your care can make a significant difference. Remember, regrowth is possible, even after significant loss. With advances in research and treatment, there is more hope than ever for people living with alopecia areata. Androgenetic alopecia, better known as male or female pattern baldness, is the most common cause of hair loss. It's driven by genetics and hormones, especially DHT, which shrinks hair follicles over time. Men often see a receding hairline and thinning crown. Women usually notice diffuse thinning on top. Treatments aim to block DHT or stimulate follicles, minoxidil for both sexes, finasteride for men, and sometimes anti-androgens for women. Early intervention can slow or even reverse thinning. The pattern and timing of hair loss often run in families. Understanding your risk helps you act sooner. There are effective, research-backed options for managing this type. Stressful events can trigger telogen effluvium, causing sudden, diffuse hair shedding. This happens when a shock pushes many hairs into the shedding phase at once, often noticed months after the trigger. Common causes include illness, surgery, childbirth, or emotional stress. The good news: telogen effluvium is almost always temporary, and hair regrows as your body recovers. No special medication is needed, just time, patience, and addressing the underlying cause. Anagen effluvium, on the other hand, is rapid hair loss during the growth phase, usually from chemotherapy. This type is also reversible once treatment ends. Both conditions highlight how sensitive hair is to changes in your body. Recognizing the cause helps set expectations for recovery. Most people see full regrowth with time and support. Traction alopecia is hair loss from repeated tension. Think tight ponytails, braids, or weaves. It usually starts along the hairline and is reversible if caught early. Signs include thinning broken hairs and sometimes bumps or tenderness. If the tension continues, follicles can be permanently damaged, leading to scarring and irreversible loss. Prevention is key. Choose looser styles, avoid tight accessories, and give your hair breaks. Listen to your scalp. If it hurts, it's too tight. Early changes can save your hair. If you notice thinning, act quickly to reverse the damage. Healthy hair habits make a big difference. Protect your follicles for long-term hair health. Scarring alopecias are rare but serious. Here, inflammation destroys hair follicles, replacing them with scar tissue. Lichen planopilaris and frontal fibrosing. Alopecia are common types, often causing patchy or band-like hair loss. Central centrifugal cicatricial alopecia mainly affects women of African descent, starting at the crown and spreading outward. Early symptoms can be mild, itching, redness, or tenderness, but progress to smooth, shiny, bald patches. Other forms, like folliculitis decalvans and discoid lupus, involve pustules or scaly lesions that scar as they heal. The main goal is to stop inflammation and prevent further loss. Early diagnosis and treatment are critical to preserve remaining hair. Treatments include topical or oral anti-inflammatories and sometimes antibiotics. Scarring alopecias can be emotionally tough, so support is vital. If you notice persistent scalp symptoms, see a dermatologist promptly. Some hair loss is caused by friction or pressure, like babies losing hair from rubbing against a mattress or adults from tight headwear. These types are usually temporary and resolve when the friction or pressure stops. Pressure alopecia can also occur after long surgeries, but hair typically regrows. Congenital alopecias are rare and present at birth, often due to genetic mutations affecting follicle development. Some babies are born with little or no hair or with fragile hair that breaks easily. These conditions may be part of broader genetic syndromes. Hair shaft abnormalities, like beaded or twisted hairs, can also cause breakage and apparent thinning. Diagnosis often requires a specialist and sometimes genetic testing. Gentle hair care is crucial for fragile hair types. Recognizing these rare forms ensures proper management and support. Diagnosing hair loss is detective work. Your story is the first clue. Doctors ask about timing, symptoms, family history, styling habits, and recent stress or illness. A scalp exam checks for patterns, inflammation, and active shedding. The hair pull test and close inspection of shed hairs help pinpoint the cause. Dermatoscopy gives a magnified view of follicles and scalp, revealing key diagnostic features. Sometimes a scalp biopsy is needed to confirm the diagnosis, especially for scarring types. This small procedure provides a clear look at follicle health and inflammation. Accurate diagnosis is the foundation for effective treatment. The right workup leads to the best results. Treating alopecia is a highly individualized process, as the best approach depends on the specific type and cause of hair loss. There's no universal cure, so it's important to work closely with a healthcare provider to tailor a plan that fits your unique needs and goals. For those experiencing pattern hair loss, medications like minoxidil and finasteride are often the first line of defense. These treatments can help slow hair loss and, in some cases, encourage regrowth. Women may also benefit from anti-androgens, which target hormonal causes of hair thinning. In recent years, innovative therapies have emerged. Laser therapy devices, platelet-rich plasma, PRP injections, and hair transplant surgeries are now available for select patients, offering new hope for those who haven't responded to traditional treatments. For autoimmune types like alopecia areata, the focus shifts to calming the immune system. Treatments may include corticosteroid injections, topical immunotherapy, or newer medications like JK inhibitors, which can help restore hair growth by targeting immune pathways. Scarring alopecias, which can cause permanent hair loss, require prompt intervention with anti-inflammatory medications to prevent further damage and preserve remaining hair. But treating alopecia isn't just about the physical symptoms. The emotional toll of hair loss can be profound, affecting confidence, self-image, and daily life. Many people experience feelings of sadness, frustration, or embarrassment. It's completely normal to grieve the changes in your appearance and to feel anxious about the future. Reaching out for emotional support is a vital part of the healing process. Talking to loved ones, joining support groups, or seeking counseling can help you process your feelings and build resilience. Patient organizations and advocacy groups offer valuable resources, education, and a sense of community. They can connect you with others who understand what you're going through and provide guidance on navigating treatment options. Remember, you're not alone on this journey. There are people and organizations ready to help, encourage, and support you every step of the way. With a comprehensive plan that addresses both the physical and emotional aspects of alopecia, it's possible to regain confidence and improve your quality of life. Take the first step today. Reach out, explore your options, and remember that support is always within reach.